Following is a paid program. WFEA is not responsible and accepts no liability for any of its content. The opinions, views, and advice expressed during the show are solely those of its participants and not those of WFEA, its advertisers, or management, and should be used as such, as every individual situation is different.
It's time for On Call with Minuteman Health, bringing you an hour discussion with New Hampshire physicians and healthcare experts on topics ranging from specific medical conditions to our changing medical system. On Call with Minuteman Health, helping you understand healthcare. And now, here's your host, Scott Colby.
Good morning, folks, and welcome to On Call with Minuteman Health. I'm your host, Scott Colby, and welcome to Wednesday, a brisk Wednesday in January, a wonderful, beautiful day that we have in store for us. Before we get started, for those of you who were tuned in during the news break and leading up to this show, you heard an ad for the Forest Service, and it's the first time I've heard it. It was awesome. Heather's shaking her head going, I can't believe he's saying that. But it was really cool. I love that ad. I'm going to download it. In the studio with me this morning is Dr. Syed Razvi of the Elliott Center for Wound Care and Hyperbaric Medicine here in Manchester. Good morning, Dr. Razvi, and welcome to the show.
Good morning. Thank you.
It's great to have you here, and thanks so much for agreeing to come on. Dr. Razvi is here to discuss wound care. And Dr. Razvi, as I told you before, I'm very excited, genuinely excited about this show. And after you and I met earlier this week, my wife and I went on a walk, and we talked all about what you and I talked about. And so it's going to be good. And it's a really important topic. The show has been running about 2 years, I think I might have mentioned to you.
Yes.
And we have not had a wound care specialist on, so this is a really good topic, and let's jump in. So before we get to the actual clinical part, let me do a brief introduction for the benefit of our listeners. Dr. Syed Razvi is a physician, as I said. He is the medical director with the Elliott Center for Wound Care and Hyperbaric Medicine here on Queen City Ave in Manchester. He attended medical school in India and completed his residency at St. Elizabeth's Medical Center in Boston, and he is board certified in general surgery. Dr. Razvi, a pleasure to have you here this morning.
Thank you.
So why don't we start the show by maybe defining, or before we define the obvious, what is a wound? How is it that you, in your career as a general surgeon, ended up, I don't want to say that in a negative way, but how did you end up in wound care? What drew you there? That's a better way of saying it, more positive. What drew you to wound care?
Sure. Wound care is an up-and-coming specialty, and it can be considered a subspecialty of general surgery.
Okay.
Because all surgeons have to take care of wounds they create themselves.
Right. Good point.
An operation, right?
Sure.
So I found it intriguing that, and I also noticed that a lot of surgeons, once they have any kind of a complication, don't like to take care of those wounds.
Okay.
And they're looking for help.
Okay.
So that got me interested, and I started doing part-time wound care even when I was in active practice of surgery.
Okay.
And then I thought that would be a great exit strategy for me to, when I wanted to stop operating, but stay in touch with surgical problems, to shift my concentration onto wound care. So that's what I did.
Oh, very good. Yeah. Very good. So it was a natural progression.
Correct.
As a subspecialty of general surgery, it made sense to move in that direction. And your colleagues, for better or worse, who didn't particularly have an affinity for treating wounds that went awry, probably appreciated that expertise.
Very much so.
And again, a little bit of your history. You practiced for many years as a general surgeon, if I'm not mistaken, in the Boston area. Is that correct?
Correct.
With Tufts Medical Center?
Not at Tufts, but I was on the faculty of Tufts Medical School.
Tufts Medical School.
I practiced at St. Elizabeth's Medical Center.
Got it. Very good. Very good. Well, thank you for that. We have a few minutes before we hit our first break, and why don't we go back to the topic at hand? And if you could, Dr. Razvi, define for us what exactly a wound is. Again, seems very basic, but it would be good to know clinically what is a wound.
In simple terms, a wound is any break in the skin.
Okay.
The wounds can also be internal, but we are basically referring to what happens to the outside of the body. So,
in your particular specialty, in your particular clinic, you're focused on the outside.
Correct.
Okay.
So any break that occurs for whatever reason, whether it happens spontaneously because of underlying disease like diabetes or venous disease or lack of circulation, or it happens from injury. And that's probably one of the most common reasons we see people for skin tears and wounds created by any kind of objects hitting them or striking them.
Okay. When you say, you said that wounds can occur spontaneously through venous disease, lack of circulation, or injury or trauma. Can you flush those out for me? What do you mean by spontaneously? Just the skin just breaks open?
Correct. Yeah.
And when does that happen?
Well, it can happen anytime, and usually happens when the underlying problem has been neglected or ignored.
Okay.
For example, one of the things that you did not mention was diabetes. So if somebody has uncontrolled diabetes, does not take care of their sugars and does not stick to a particular diet, they're likely to get into trouble by spontaneously a minor scratch or anything can turn into a major wound.
Okay, so that's what you mean by spontaneously.
Correct.
Okay, you don't mean I'm walking down the street and all of a sudden, boom, there's a hole in my hand.
No.
Okay, all right, I'm sorry. I'm very literal, Dr. Razvi.
That's right.
Venous disease, again, how does that relate to a potential wound?
Right. People who have varicose veins, again, that have been ignored or neglected.
Okay.
Their pressure in the veins rises to a degree where some of them even have rupture of a vein and they can bleed.
Okay.
But a lot of times because of increased pressure, the skin suffers and it undergoes a change which makes it extremely susceptible to breakdown.
And without going too far off of the topic or your specialty, could you just define maybe in simple terms for us what a varicose vein is?
Okay. A varicose vein is a vein usually on the surface underneath the skin that has become dilated and tortuous.
Okay. Okay, and you can actually see it. It looks like a tube on somebody's skin.
Correct. Most of the times you can.
Okay, you can.
You can, but sometimes you may not.
Okay.
Yeah.
Okay. Lack of circulation, the reason that could lead to a wound, what would that reason be?
The lack of circulation can be secondary to diabetes, which is very common, but the normal aging process, which produces hardening of the arteries, can also produce lack of circulation.
Okay. You mentioned injury, and of course injury takes many forms, and then you've mentioned a couple times diabetes. We are actually going to be coming up on break in just about a minute. So what I'd like to do, Dr. Razvi, is I'd like to take this point to stop. And cut away to break. And when we come back, I want to talk about diabetes because I don't want to say I had an epiphany. It's that time of the year, but it was a revelation for me when you described diabetes and wound care and uncontrolled wounds. Dr. Syed Razvi, Medical Director of the Elliott Center for Wound Care and Hyperbaric Medicine, is in this morning to discuss wound care. He's happy to take your calls. The number is 603-669-1370. Again, 603-669-1370. We'll be right back.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
St. Joseph Hospital now gives you more room to relax inside our new wide-bore MRI, used to help diagnose possible injury or illness. Patients who might find conventional closed MRIs difficult to tolerate no longer have to sacrifice comfort for the quality of their images. St. Joseph Hospital's new MRI unit will provide you with a faster, quieter, and more comfortable MRI exam without that closed-in feeling. We offer appointments 7 days a week for added convenience, and we promise to provide your exam results as quickly as possible. Top quality imaging for precision diagnosis. Expert care in a stress-free, patient-friendly environment. The latest innovations and technologies. It's just what you'd expect from St. Joseph Hospital. To learn more about our new wide-bore MRI, visit us at stjosephhospital.com. That's stjosephhospital.com.
When your diagnosis includes the word cancer, you want your care to be the best possible. At New Hampshire Oncology Hematology, their mission is to provide expert and compassionate care for adults with cancer and blood diseases. Their providers are committed to their patients and their fight. All members of their staff value honesty, teamwork, and communication with patients, their families, and all members of the care team. You and your family will always be treated with dignity and respect at New Hampshire Oncology Hematology. To learn more about their cutting-edge care close to home, visit NHOH.com.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Dr. Syed Razvi, Medical Director for the Elliott Center for Wound Care and Hyperbaric Medicine here on Queen City Ave in Manchester at the Elliott at River's Edge, right?
Correct.
Dr. Razvi is here this morning to discuss wound care and is happy to take your call. 603-669-1370 is the number. So, Dr. Razvi, when we went on break, we talked about a few of the causes of wounds, and the types of wounds. So we talked about spontaneous venous disease, lack of circulation, injuries, diabetes. And when we were on break, you said, but we really need to mention burns before we delve into diabetes. So, yeah, take it away, please.
Sure. So there are a couple of other reasons why I see people in our clinic is burns that people sustain, and they're unfortunately, they're quite common, and they can be as a result of an accident or hot liquids spilling on somebody or steam burns at work.
Okay.
But something I mentioned to you that I noticed particularly more so in New Hampshire than I did in Massachusetts was I see a lot of people who have burns from hot mufflers on a motorcycle.
Wow, really?
And yes.
Typically on their legs, I'm assuming?
On their legs, correct. On the calf of their leg.
I wonder why that would be, because I would assume that the motorcycles that we drive up here in New Hampshire are designed the same way as the motorcycles that you drive in Massachusetts.
Right.
I'm just saying, right?
Maybe they're used more often. I don't know.
Yeah. Okay.
But the traffic in Massachusetts, I think, prevents people from getting on a motorbike because they're basically taking their life in their hands.
Yeah, there you go. Maybe that's what it is. Right. Yeah. There's just less people on motorcycles.
Right.
So, but burns. So that's really important. So that's another category of wounds.
Correct. And also we didn't talk about surgical wounds. When people have any operative procedure and ends up with a wound that hasn't healed, I generally see them when they have been healing problems for more than a month or so.
Okay.
And they end up in our clinic.
And that's general. That's sort of the general guideline that you'll talk about in a minute, and that is if you've got something brewing for 30 days and it's not healed, you probably need to seek medical attention.
Correct.
Okay. But before we get into some of the do's and don'ts in some of the treatments for wounds, could you talk about diabetes and the impact on wounds? And the reason why I want to focus on this is, as I told you, Carla and I, my wife Carla, and I were out for a walk after you and I had the chance to meet, and I was sharing with her diabetes and wounds and what we had discussed, and she, like me, was fascinated. So please.
Sure. So diabetes affects people in many ways, and not only that, the high uncontrolled sugar plays a role in allowing bacteria to grow, but they also suffer from lack of circulation.
Right.
And when there is diminished blood flow, there is less oxygen reaching the tissues, and some bacteria thrive in that kind of an atmosphere.
Anaerobic bacteria.
Anaerobic bacteria.
How do they do?
Very well. Very well. And lastly, I also mentioned that diabetics lose feeling. They develop what's called neuropathy. And when they have no sensation or lack of sensation in their feet, they're likely to step on sharp objects. They're likely to have wounds that they don't know about.
Right.
And to make things matters worse, they also have diminished eyesight from diabetic retinopathy.
So they can't do a self-inspection effectively.
They can't do a self-inspection effectively. That's correct.
Right, right. But in one of the other elements, and you did touch on it a minute ago, but I just want to go back to it because it was an aha moment for me. If you're diabetic with an elevated blood sugar level, bacteria needs a food source, and bacteria thrives on sugar. And so if your blood sugar is elevated, there's an abundance of supply of food and energy for bacteria to grow, and that contributes. And I never put that together before.
Right. Well, it's not only that, but they also, the fact that when you have a high blood sugar, your body's healing capability is diminished as well.
Oh, okay. So it's a double effect.
It's a double effect.
Oh, right. Wow. Very interesting. So we talked, we've defined several different types of wounds. And before we get into some of the do's and don'ts, you did mention that age can play a factor in wounds for a couple different reasons. I believe one had to do with the skin itself and the elasticity or lack thereof,
right.
And circulation and other things. Could you talk about aging in wounds?
Sure. So there are a couple of things that happen. One is as we advance in age, we become less mobile. We also become a little bit more clumsy. So we have a higher risk of fall.
Okay.
And that gives traumatic wounds. And we also tend to not eat properly. And if you don't eat properly, your nutritional status deteriorates.
Okay.
And when you don't have good enough protein in your system and you're not taking any vitamins, all these things can contribute to anything that happens will continue to linger on.
So could we stay with this for a second, sure. Dr. Razvi? On the nutrition side, it seems very intuitive that if you have poor nutrition, your body's not going to function optimally and you're going to take longer to heal. But specifically, you mentioned protein,
right.
And the need for protein. Why is protein important in a wound healing?
Right. So if you look at the details of wound healing, you have to have different materials available for building what simply would call building blocks. So how the wounds heal. And collagen plays an important role in healing of wounds.
Okay.
And
collagen is what?
Well, it's a substance that takes part as one of the steps of healing.
Okay.
And so unless you have certain elements that are provided for the wound to heal, and another element that we haven't talked about so far is zinc. Zinc is very important. And some of the other substances in a balanced diet, unless you get those, the wound is not going to heal properly.
Okay. So it's like obviously the body needs proper nutrition to function optimally, and one of the functions that the body is good at is healing itself, is taking care of a wound.
Correct.
And so if you don't have proper nutrition, protein, zinc you mentioned, is there anything else besides protein?
Well, there are other vitamins that are necessary, and we have also found out recently that because of the propaganda of harmful effects of exposure to sunlight, people are staying out of the sun. That causes vitamin D deficiency.
Okay. Unless
our skin is exposed to a lot of sunlight, we don't have the conversion of D that is usable by the body.
Okay.
So a lot of people now require vitamin D supplement.
Oh, interesting.
Yeah.
What about, something just popped into my head. I'm a child of the 70s. Those who are regular listeners know this. And a good friend of mine, my next door neighbor, he burned his hand seriously as a child. I don't remember how it happened. But what I do remember is that it was wrapped in gauze, and his mom would have to apply a liquid vitamin E ointment to it. Now, technology changes and science improves, and that may not be a standard of care, but is there anything to vitamin E relative to wound healing?
Actually, no, because a number of studies have been done which have disproven.
But at the time, they thought that was effective?
Yes.
So you're not surprised to hear me say that?
Not at all, because people even took vitamin E by mouth.
Okay.
And a lot of people still do, thinking that it helps. But a number of well-controlled studies have shown that it's not effective.
Okay. And that's a really nice segue, Dr. Razvi, into the do's and don'ts. And another thing, let me bring you back to Scott's childhood again, okay? And when I was a kid and you got that scrape that you didn't want to tell Mom about, but that you had to tell Mom about because it was too big. And some people used mercurochrome. My mother used methylate. It was essentially the same red. It felt like acid. And I remember as a little boy sitting on the counter trying not to cry, and my mother would say, okay, say it. And she'd put the stuff on the cut, and it would sting like heck. And I'd be like, it does not hurt, it does not hurt, it does not hurt, it does not hurt. And I'd blow on it. That doesn't work.
No.
You can't. I think you might have even said you'd be hard-pressed to find mercurochrome or methylate in a store. Right? So there are some other things that we don't use any longer. So what don't we use, and what are we supposed to do with a wound, with a cut?
Right. So normally we tell people just to use soap and water, which is soap and water is
temperature of the water. Does that matter?
Doesn't matter. Whatever is tolerated is fine. But a very common mistake made by people, and it's a carryover from actually my training days, is using peroxide. Everybody wants to wash their wounds with peroxide, and we have
Carla and I talked about this too.
So we have shown in many studies that peroxide actually does harm to good, healthy cells.
Interesting.
And this is why it should be avoided. And I have, unfortunately, recently seen people who have used peroxide for a number of months and made their wounds a lot worse.
So let me just go back to this, because what you're saying is methylate and mercurochrome might not have worked.
Yeah.
But you're saying that peroxide, not only does it not necessarily work, it should be avoided.
Correct.
And that is because?
Because it harms healthy cells.
It harms healthy cells.
Correct.
So there was a myth that when you would dump the peroxide on a cut, first of all, I never minded using it because it didn't sting.
Right.
And second of all, it would fizz.
Right.
And everybody would say that's the peroxide killing the infection. Yeah. That's not the case at all.
No. Not at all.
That's the peroxide killing healthy cells, right?
Right. Well, the fizz, people used to consider that all the bad humors are coming out.
Right.
But that isn't the case.
That's not the case at all.
That's released. Actually, when it comes in contact with tissues, free oxygen is released.
Okay.
And it's the release of oxygen that produces the fizz.
Okay.
But that doesn't really do any good.
So nothing to do with killing an infection or germs.
No.
And what you're saying is, again, that the peroxide, as a specialist, you would recommend against using peroxide.
Correct.
Okay. All right. Fair enough. Antibiotic ointments. You see those over the counter. Let's not name names because you're not a fan, and so I don't want to get sued. But antibiotic ointments? But
in general, we discourage people from using indiscriminately any antibiotic that's available over the counter.
Right.
Because I've seen a number of people have allergic reactions to them.
Really?
Yes. And again, a lot of controlled studies have shown that these antibiotics that are available over the counter are ineffective in preventing an infection.
Okay.
So if you balance out benefits versus harm, I think it does more harm than good.
Right. And so when you say that they have a reaction to the antibiotic ointment, what kind of reaction is it? Is it just additional inflammation of the wound, or?
Yeah, the wound, the surrounding area turns red, and sometimes they get very harsh burning rash around. And, some antibiotics cause more than others, but and in some people there is a more severe reaction than other people.
Okay. All right. Good. Well, Dr. Razvi, we're actually going to be coming up on break again in just a second. So we're going to take this moment to pause. When we come back, let's talk about the use of the Band-Aid, and then we're going to get into actually what you do in your center for those wounds that are just not controlled. Dr. Syed Razvi is the medical director of the Elliott Center for Wound Care and Hyperbaric Medicine here in Manchester. He's in this morning to discuss wound care. He's happy to take any calls you might have, any questions you might have. 603-669-1370 is the number. Again, 603-669-1370. We'll be right back.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
At Catholic Medical Center, we believe that excellence in healthcare and personal respect for our patients go hand in hand. From our primary care and laboratory services, the Mom's Place, to our minimally invasive robotic surgery, CMC meets your every healthcare need. Our expert specialists and caring medical staff are dedicated to being your lifelong partners in good health. CMC, leading the way with heart. Find out more at CatholicMedicalCenter.org.
When you have digestive problems, you need to turn to a gastroenterologist who listens and responds, an experienced doctor who knows the field and can effectively diagnose and treat your needs. New Hampshire Gastroenterology in Bedford is now opening a new office in Nashua. You'll receive the same superior and compassionate care from their dedicated team of trained gastroenterology professionals who give you the individualized care that you deserve. Call New Hampshire Gastroenterology today at 625-5744 or visit nhgastro.com for their 2 locations in Bedford or Nashua.
Our military service members volunteer to protect us in the most dangerous places around the world. They step up. And when they are severely ill or injured, returning to their families is only the beginning of their long road home. Wounded Warrior Project provides these brave men and women whatever they need to continue their fight for independence at no cost for life. So now it's time for a grateful nation to step up. Join us at findwwp.org.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. My name is Scott Colby. I'm the host of the show, and welcome to Wednesday again. In the studio with me this morning, Dr. Syed Razvi, Medical Director of the Elliott Center for Wound Care and Hyperbaric Medicine here in Manchester. Dr. Razvi, the show is half over. It goes pretty fast, doesn't it?
Yeah.
And, you know, I just thought as I was saying that, I was thinking that the regular listeners to the show, and I hope there are many, hello and thanks again for tuning in, folks, they hear me say that every week. And I don't say it unless I mean it. It does. The show always flies. It's crazy.
Yeah.
It's crazy. It's good. So I want to invite the listeners to call in again if they have any questions about wound care. 603-669-1370 is the number. And, again, that's 603-669-1370. So when we went on break, we were talking about some of the do's and don'ts, more the don'ts, I think, than the do's. And the don'ts include don't use peroxide on a cut. Don't use antibiotic ointments that are over-the-counter. The only time you would use anything like that is if it's prescribed by a physician. Don't use methylated mercurochrome because you probably can't buy it anymore anyway, and it stings. It really stings. And what you should do for a wound, and be reasonable about this, is use soap and water to clean it. And when I say reasonable, if you're bleeding profusely and you can't control the bleeding, then obviously you're going to need sutures, stitches, right? So get some emergency medical treatment, right, Dr. Razvi?
Right.
Yeah. So can you just give us maybe some parameters around when to get the medical treatment and incorporate into that the use of Band-Aid before we get into what you do in your office?
Sure. For minor cuts, I think it's perfectly all right to use home remedies and to put a Band-Aid on. Mm-hmm. And in a simple cut, it's not even harmful to use the antibiotics that I said not to use.
Right.
If you just don't want...
it won't necessarily help, but
correct.
It won't necessarily harm either.
Right. In a simple cut, that's not a problem.
Unlike peroxide, you said stay away from it.
Right. Peroxide you stay away from.
Okay.
And if somebody has any kind of a significant wound that fails to heal, whether... for example, if they were cutting something and they sliced a portion of their finger, yeah. So it's going to not be a simple cut, but it'll be actually a wound. Mm-hmm. And if that wound doesn't start to heal, then they need to have attention. One of the things I promote is that do not go for non-stick dressings. It's a very common mistake to use non-stick dressings.
What do you mean by non-stick dressings?
There are pads available in the market that are shiny And,
Okay.
And they are they're sort of waterproof and non-absorbent, and they won't stick to your wound. So that's the attraction. People don't want things sticking to their wounds, so they tend to use them as dressings. And those are harmful to your wounds because any drainage from the wounds is not absorbed, and it stays right where it happens.
So some of us were told that the best thing for a wound is let the air get at it. And what you told me the other day when we were meeting is that's not the case. The use of a dressing or a Band-Aid or something like that is recommended.
Correct.
And why is that?
Well, that's only because, a lot of people, you're not existing in a sterile atmosphere.
Right.
And you have pets at home. The air may not be the cleanest. So if you have it exposed, even though you're home, it can still get an infection.
Okay. So that protects it just from that,
Correct.
from the dirt.
Yeah.
Right?
From dust, from pet hair, from all kinds of exposures that people might have.
And so going back to what you said, just to restate, I don't want it to sound like I'm trying to go to medical school here, but you said you want the dressing, you don't want it to be a non-stick. You want it to absorb because while you want the wound covered, you want something that will draw out the infection. Is that really what you're trying to draw out?
Not necessarily infection, but you want to prevent infection.
Okay.
So you're drawing out any drainage that occurs. If you have an open wound, you're bound to have some drainage. And drainages of serum or fluid, body fluid that comes out. And you want that absorbed. You don't want it sitting right next to your wound.
Okay. All right. Very good. Very good. So now let's talk about, if we could, when a wound doesn't heal, at what point should somebody see their doctor, and at what point would they come to your center, Dr. Razvi?
Okay, so I generally tell people that, the old teaching has been that if a wound hasn't healed for a month, you should seek attention at a wound center.
Okay.
I don't agree with that 100% because I don't think one should even wait a month.
Oh, okay.
If something happens and if the wound doesn't show progress from week to week, then they should definitely consider attention because the wound should be showing some change for the better each week. Actually, a person can even notice it day by day. But anything changes in the wound, like redness develops or pain increases in the wound, these are signs of trouble.
Is another sign of trouble if the wound feels hot around it? Would it be hot to the touch?
Yeah, it just hot alone may not be enough, but if it's hot and red, then that might be a sign of trouble. And usually from a medical standpoint, we look for what's called streaking. We see red streaking going up from the wound. Whether if it's a finger wound and streaking going up the hand and the forearm, then that's a sign of trouble.
Let me ask you this. So this is something that we've done on ourselves and we did with our kids, and they're older now, so they survived it. But when they would get a wound or a cut, and it looked pretty bad, but it didn't necessarily warrant going to the doctor, we would take care of it. At the time, we used peroxide. Probably shouldn't have, right? But we did. And if it looked like it had the potential to be serious, or a bug bite that had the potential to be serious, we would actually take a marker and draw a circle wide around it.
Right.
And if the redness approached that line, then we thought something was probably brewing, and we'd go to the doctor. Is that sound advice, or is that stupid?
No. It's a very sound advice, and I think we still do that.
Okay.
We do that all the time.
You do it as a clinician?
We do it as a clinician.
Okay.
Right.
But if you do it at home, obviously you don't want to put a Sharpie inside of a wound. You want to be well around the outside.
Yeah,
Okay.
Any magic marker or anything that will stay on the skin is preferable.
Because am I safe in saying that the reason is if the redness progresses, chances are there's an infection that's progressing and it's moving under the skin?
That's correct.
Okay. So if you're seeing redness, pain, streaking as you described it, then you want to see your doctor.
Correct.
And so by the time the primary care physician refers somebody to you, because I'm assuming most of your patients come through a primary care, that they're beyond primary care right?
Yeah, we also get a lot of referrals from urgent care.
Urgent care as well. Okay.
Correct. So because not everyone is able to access their primary care immediately.
Mm-hmm.
So if they have a problem, they end up in an urgent care. And even though they might have had a wound for a few days, they would still go to urgent care because when they call their doctor's office, they may not be able to see them right away.
Right.
So urgent care would then contact us to tell us what's going on and take our telephone advice pending they're coming to our clinic.
Okay. So Scott walks in
Yeah.
to your clinic. Obviously, I have a wound that's not healing. Something is brewing.
Right.
What's the protocol? What do you do?
Right. So there are several things which are baseline. They are first interviewed by a nurse who takes a detailed history of their medical conditions and their health. And then she would also go into a detailed nutrition history to find out if they're eating well and if they have enough food to eat and whatnot.
Mm-hmm.
And after that, they'll be seen by a provider, either a nurse practitioner or a doctor.
Okay.
And we determine if they have adequate circulation to the area first to make sure they're not a diabetic, and if they are a diabetic, their blood sugars are well controlled.
Okay.
And then we look at the wound, and a lot of times we would see on the wound what we call as slough. Which
Slough?
Is slough.
Okay.
And
we didn't talk about this the other day.
No, we didn't talk about it.
Because I would have remembered slough, Dr.
I
Razvi.
didn't want to make you sick.
Well, I hope everybody's done. Okay, disclaimer, I hope you're done with breakfast, folks. Go ahead.
So,
slough, huh?
Right.
What is slough?
So slough is basically accumulation of dead cells on the surface of the wound. And in cases where there is an infection, the bacteria can form what's called a biofilm. It's like a casing to protect themselves from destruction, basically.
So far, it sounds pretty benign, but I think you're gonna use the word pus in a minute, aren't you?
No, I'm not.
Oh, okay.
I'll avoid that.
Okay, thank you.
So this needs to be cleaned away or scraped away.
Okay.
For the wound to get back on track.
Sounds painful.
Well, what we do is we generally, as a routine, numb the area.
Okay.
So we put a numbing gel
on
the patient's wound, and then gently remove this debris which has accumulated on the wound to get it back on track.
Okay. And that is, in lay terms, the slough that you're seeing.
Correct.
That is indicative of an infection.
Correct.
Yeah. Okay. So you would clean the wound. That's one of the things that you might do.
Right.
Beyond cleaning, do you go deeper?
We would also send a portion of that clean stuff for culture.
Okay.
To the lab to check for what kind of bacteria are in there.
So the slough, is that a slang term or is that a clinical term?
It's a clinical term.
Really? Okay. So you would send the slough to the lab to be tested.
Correct.
To confirm infection or?
To confirm what kind of infection. First infection, and then if there is infection, what kind is it?
Okay. Okay. Because presumably the treatment would vary depending on what kind of infection it actually is. Okay. So that's sort of a cleaning of a wound that appears to be infected. Right. What other types of treatments do you employ?
So that cleaning, just so people know, is called debriding the wound. And there are different ways of debriding them. Sharp instruments, a piece of gauze, or some people use...
when you say gauze, you're talking about actually wiping the wound out with gauze.
Correct.
You put a numbing gel on it so that the patient doesn't feel pain.
That is correct.
And you use gauze to actually just scrub it.
That's right.
Okay.
That's right.
Okay.
And then we also use pulsatile spray of saline solution. It's called pulse lavage.
Okay.
That can be used. We don't have it available in our center, but that we can refer people for that.
Okay.
And it's very useful in cleaning the wounds.
Okay, very good. Well, Dr. Razvi, we're actually up against break now, so we are going to cut away for a minute. I'd like to invite our listeners to call in and ask any questions they might have about wounds. Ask them of you. Dr. Syed Razvi, Medical Director for the Elliott Center for Wound Care and Hyperbaric Medicine. 603-669-1370 is the number. Again, 603-669-1370. We'll be right back.
Primary care, it's what we do for new and existing patients, and we do it on your terms. Whether it's family or internal medicine, St. Joseph Healthcare's primary care physicians are just a phone call away. We're here for you with extended evening and weekend hours open to everyone at our easy-to-reach Amherst Street location in Nashua. Sick now? Same-day appointments are available in Nashua, Hudson, Merrimack, and Milford. Need convenient, high-quality health care? Call Dr. Link at 800-210-9000. St. Joseph Healthcare.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
At Catholic Medical Center, we believe that excellence in healthcare and personal respect for our patients go hand in hand. From our primary care and laboratory services, the Mom's Place, to our minimally invasive robotic surgery, CMC meets your every healthcare need. Our expert specialists and caring medical staff are dedicated to being your lifelong partners in good health. CMC, leading the way with heart. Find out more at CatholicMedicalCenter.org.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Dr. Syed Razvi, Medical Director for the Elliott Center for Wound Care and Hyperbaric Medicine here in Manchester. And Dr. Razvi is here to answer any questions you might have about wound care. 603-669-1370 is the number. And Dr. Razvi, here we are in the last segment. It flies.
It does.
It does. Okay, so when we went on break, we were talking about some of the treatments that you would employ once a patient presents with a wound in your center, something that can't be controlled at home. You mentioned debridement, and you mentioned, as we were going on break, a saline wash, pulse lavage, you called it?
Correct.
What's the benefit of that?
The benefit is better cleansing agent.
Okay.
And usually people do that every day.
Okay.
And in most institutions, it's under the physical therapy department.
Okay.
And they are trained to do this.
Okay. And also in the physical therapy department, I'm looking at my notes from the other evening, electrical stimulation?
Correct.
Can you talk about what that involves, whether there's a numbing agent involved in that, and just the concept of how it works?
Yeah. There's no numbing agent involved.
Okay.
But the concept is stimulating the wounds to heal.
Okay.
And when wound stops progressing, we basically medically call it stalled.
Okay.
So if a wound has stalled, you want to do different kinds of things to kickstart it again.
And is that are you talking about kickstarting blood flow? Is that what this is about?
Not really blood flow, but there are so many chemical actions taking place in a wound healing process that some of those processes just halt.
Okay.
And so you want to kickstart all those processes.
Understood.
And that's why we use these different modalities to do that.
And electrical stimulation may
is
do
one
that.
of them.
Okay.
Yes.
All right. Very good. And there are some times when you have to use biologic dressings, right? And can those be, you're going to describe what those are, but can biologic dressings be applied in your center, or is that more of an inpatient procedure?
No, it's an outpatient procedure.
Okay.
And we do them in our center. And the only negative thing about biologic dressings is that they are very expensive.
Okay.
And
are they effective?
They are effective when applied at the right time in the proper patient.
Okay.
Unfortunately, there's a lot of misuse of these products, and they're applied on wounds where if I looked at those wounds, I would say that it's not going to work.
Okay.
But and it's each dressing is approximately $1,600 to $1,800.
Wow. And what are they? Could you define for the listeners what is a biologic dressing?
One of the most commonly used dressing comes from a human foreskin. It's made from human foreskin.
Okay.
And there are processed dressings or pieces of tissue that are inert. They are not live.
Okay.
They are inert pieces of tissue. And they, again, stimulate certain elements in the wound to start making skin.
Okay.
They themselves, the artificial tissue itself does not adhere to any person, and it does not convert to good skin.
Okay. It just stimulates the body to grow good skin.
That is correct.
So ultimately it gets thrown away.
Right.
Okay.
It actually dissolves by itself. So
okay.
When you see the patients in follow-up a week or two later, the thing has disintegrated and gone, basically.
Okay. So there are also, I think you had mentioned the other night, in addition to foreskin, animal products are used as well.
Correct. So we have used in the past tissues from pigs.
Okay.
And so porcine products have been used. And then there's some created products, what are called artificial dermis.
Okay.
And there are different kinds of products used in the wound, but the general consensus is unless the wound is clean enough to be receptive to these products, they're basically wasted. So we are very selective in using these products.
And so if a wound is too large or too deep, is there a risk that it's not clean enough and you wouldn't use a biologic on it?
I don't think the size has anything to do with it.
Okay.
It has more to do with the kind of what we call as a wound bed, what's lining the wound.
Okay.
And we like it to be full of healthy, what we call as granulation tissue.
Okay.
And these are pink buds in the wound, which are very sensitive, and when we brush against them, they bleed very easily. So that's a healthy sign of health.
Okay.
When that happens, which means there is adequate blood flow to the area.
Right.
And this is new healing tissue that the body is trying to produce.
Okay.
So those kind of tissues would accept a biologic product. Not only that, but they would also accept what we do surgically as a skin graft.
Okay.
So if there's a large wound, we can take patient's own skin and place it on the wound.
And so before we get into surgical repair or treatment of wounds, something that would be done day surgery or overnight, there's one last modality that we talked about. I'm sure there's many more that you don't necessarily employ at the Elliott Center for Wound Care, but that it is employed in other centers, and that is maggot therapy.
Yes.
And could you just talk about that? I found that fascinating. And Heather is shaking her head. She's about to vomit. She's actually turning red. So it's not as gross as it sounds when you explain how they're deployed.
Right. So historically, people have seen maggots develop in wounds by themselves. And a fly sits on a wound, and whether it's covered or uncovered,
lays an egg, and there you go.
Lays an egg, and you have maggots. And people have learned over the years that the maggots do a wonderful job of eating away all the dead tissue.
Right.
And as that was studied, people realized that it's not the maggots eating the dead tissue, but maggots secrete fluids that digest the dead tissue. And then the maggots sort of eat that.
Okay.
So they don't have to be free in the wound.
Right.
And that has led to the new concept of producing maggots in a bag.
Right.
And
maggots in a bag. It sounds like something you'd see on TV, right? You call now and you get two.
Right. So that's available now, and it's.
I'm sorry, Dr. Heather. I have never seen her turn this red or purple. I'm afraid the show's going to end and she's going to be gone 5 minutes. This is awesome. So they come in a bag,
right?
And the concept being that the secretions goes through the bag into the wound and does what it needs to do.
That is correct.
To break down the dead skin and the dead tissue.
Right.
Okay.
And
it's scientifically proven. This isn't voodoo medicine.
No. This has been extensively studied, and extremely effective.
Okay.
And one of the reasons why we don't have it or we don't use it is, again, because of cost.
Is it very expensive?
Yeah, expensive. I don't know exactly what they cost, but at the last national meeting I was at, they demonstrated it. And it's made by a company that's not a U.S. company.
Okay.
I think they're either from New Zealand or Australia. I can't remember.
So foreign maggots. Okay. Well, you want domestic maggots. Okay. All right.
So I think it's definitely something in the future and will be used more commonly, I think.
Very good. So when somebody comes to the clinic and none of these modalities seems to be doing the job, you touched on it a minute ago, a patient may need surgery and they may need graft where you actually take their own skin maybe from a different part of the body and apply it. In that scenario, Dr. Razvi, I want to get back to the biologics. Is that similar to a biologic in that it's the graft that stimulates the wound to produce new skin? Or in that situation with a graft, does the skin that you're imposing over that wound actually take hold and live there?
It does.
That's what happens. So it actually grows there. That's what you do. So that's a pretty extensive surgery.
It's not. It's really
not.
No.
Okay.
Actually, some kinds of grafts can be done in an outpatient setting in the clinic itself.
Oh, okay.
One of the things that we didn't touch upon at all in our program is bed sores.
Oh, right. Yeah, let's go there.
It's a very problematic situation for patients who are either paralyzed or handicapped. And when you're treating bed sores, surgery plays a vital role.
Okay.
If you're unable to, because these wounds tend to be large.
Okay.
And they're at pressure points, and if they don't respond to conventional means of therapy, then we generally refer them to plastic surgeons or general surgeons, who can then remove all the tissue that's gone bad, and they can even bring muscles from a neighboring area to cover if a bone is exposed, for instance.
So the pressure sores or the pressure ulcers can actually be that deep?
They tend to go very deep.
Okay.
Yes, and typically occur on heels, on the backs, lower backs, or buttocks.
Okay.
And so surgery can move a muscle and then along with the overlying skin. So it's called a myocutaneous flap done by a plastic surgeon. And they can instantly heal the problem. And it takes maybe 10 days to 2 weeks.
And Dr. Razvi, is that flap, is that taken from adjacent tissue to the pressure sore, or is it taken from another part of the body?
No, it's taken from adjacent tissue.
So it's pulled over.
Right.
Okay.
There is a technique of taking what's called a free flap, but that's extremely rare. I mean, you have to have.
Does that include muscle too?
That includes muscle too.
It does.
But then you have to provide its blood supply and whatnot. It's much more complex.
Okay.
But just taking from the neighboring tissue is the most common procedure.
And how frequently do you see in your practice that a pressure sore progresses to the point of needing one of these flaps and one of these serious surgeries?
Unfortunately, fairly frequently.
Really?
Yeah. We sometimes have difficulty finding a surgeon who's willing to take on the challenging task.
Right.
Because they are not easy patients to treat.
Right. Right. That's pretty interesting. So surgery is an option for those patients, and it's not just pressure ulcers. It's any wound that doesn't heal.
That's correct.
Well, Dr. Razvi, I hear the music in the background. That tells me that we're wrapping up now. And it's been a great show. I think some of the major takeaways, at least for me, are attend to your wound right away. Don't use peroxide. Don't use ointments. And if it doesn't heal in a reasonable amount of time, make sure you see your doctor.
Yeah.
Fair enough?
That sounds good.
Excellent. Well, Dr. Razvi, thank you so much for being on today. Dr. Razvi, Medical Director of the Elliott Center for Wound Care and Hyperbaric Medicine here in Manchester. You've been on call with Minuteman Health. Make it a great week.